If you're living with chronic pain and you hate using opioid medications, there is another local option for you. Today, a local doctor is sharing his natural organic treatments that he uses to help patients suffering daily with really chronic pain that they just can't seem to lose, and it just stays with them. With us today is Hammond Medical Dr. Chad Domang and interventional neurologist, that's a long name,
it's a long name,
and pain management specialist at Cypress Point Hospital and the owner of Cypress Point Pain Management. Thank you so much for coming in.
Thank you for having me.
You've got a lot going on. That's a long title.
Yes,
okay.
ma'am.
Thank you so much for coming in. What are some of the different types of chronic pain that people come in and say that they are dealing with on a daily basis that you see?
Sure, and I think that's a good way to start this, is to differentiate acute pain from chronic pain. You know, God forbid you walk out here and twist your ankle. That's a new pain.
That's acute.
That's acute pain.
Yeah.
Chronic pain patients have, arthritis, rheumatoid arthritis, have failed surgeries, knees, ankles, elbows, and especially in a state where we have a lot of blue-collar workers, these are people that have sustained car accidents or work-related injuries, and over time they've tried everything, right? They've tried the surgeries, the physical therapy, and they're just stuck with a chronic state that their body just aches.
Okay, so for all the obvious reasons, we know the opioid epidemic, and people just don't want to potentially get hooked on that. So tell us what some of the things you use. Let's start with something called the spinal cord stimulator. We've got a picture of that. How does this help fight pain? What types of pain?
Yeah, so stimulator is one of my favorite. I always say I'm hot wiring God's computer. So as a neurologist, your brain perceives pain. So what a stimulator does is we insert a very small wire into the spinal canal that sends an electrical signal to the spinal cord. So it intercepts that signal before it gets to the brain. Very similar when you hit your thumb with a hammer, you rub it to flood your brain with a different sensation other than that painful one. Stimulator is a long-term device I compare it to a pacemaker. It's an implantable device and allows a patient to control the electricity, so they can turn it up, they can turn it down. So instead of reaching for a pain pill, they use that electrical stimulation to control that chronic pain signal.
It's like Pavlov's dog, you kind of keep hitting something.
I love it, absolutely.
What about the pump device? What about that?
So a pump is everything you love about opioids with the stuff you don't want. And what I mean by that is when you take a pill by mouth, you're flooding your body with the opioid into parts of the body it doesn't need to go. The pump administers the opioid directly into the spinal fluid where the nerve in the brain lives, so you can give 1/300th of the dose you give by mouth. It also doesn't give addiction, it doesn't give constipation, doesn't give euphoria, because it's administering a small dose 24 hours a day.
And the other one, Rizotomy or Rizotomy?
Rizotomy.
Rizotomy, okay.
Yeah, so rizotomy, very straightforward. You burn very small nerves in the spine or the knee to make it so a patient doesn't feel the damaged joint. So it's making it so you don't feel the arthritis of your back, which is kind of why we hunch over as we get older, or people that had knee replacements or just bad knee arthritis. It just makes it so you don't feel that chronic pain 24 hours a day.
Medical marijuana, are you using that a lot for people with chronic pain as well?
I am. I'm a big proponent of medical marijuana. I lobbied the state house, the state senate to get it passed. I've been prescribing or recommending now for about 4 or 5 months. It's a great option. I look at medical marijuana from a pure medical standpoint. There's no toxic dose. It's not affecting your kidneys, not affecting your liver. No one's ever died of overdosing on marijuana. The struggle with the marijuana is the cost and so forth.
And does the results last for a long time, or do you have to keep using these things?
So, in our state, it's only been around for 4 or 5 months.
For all of the treatments that you use?
Yeah, for the marijuana specifically. But the pain pump stimulators, those are long-term options.
Okay.
Marijuana is, right now, it's more of a cost issue because of the regulation that we have with it. So I've had patients that have put it on that have come off of opiates, do very well, but have to come off the marijuana because they can't afford it.
Right. Well, it's good to see there are options and that you're offering these, and if patients are interested, you can check it out with Dr. Domang. Thank you so much for coming in.
I appreciate it.